please tell us a little bit about yourself.
My name is Marko. I'm 31 years old. I'm married with 2 children. I currently work for the NHS Lothian in postnatal, and I started there in 2012 as a clinical support worker, and I was offered to progress further in the role to take part in the Personal Development Award course, which is what I did.
Good. Now, I understand you've mentioned the PDA, so it's PDA in Maternal Health and Wellbeing. So what made you apply for your course?
I wanted to gain further knowledge in the role and progress on to do further things, more responsibility in the ward with the patients and with babies. My ambition is to be a midwife one day, and I felt this course was going to be a further step in the right direction to get me to be applying for midwifery in the future.
Good. And what were the challenges, do you feel?
The biggest challenge was returning to studying from a long gap from education since leaving school. The other challenges was probably the work, home and studying life balance, working as a full-time shift worker with 2 young children, finding the time to do studying in quiet time, working the 12.5-hour shifts, varies of nights, days and weekends. I think that would be my biggest challenge, the work balance.
Yeah, so work-life study balance.
Yes.
Okay, and has this course made you better prepared to do your job, do you think?
Yes, I thoroughly enjoy my job. I really enjoy working in the postnatal ward. The course has provided me with a lot more confidence. I've gained so much more experience working in different areas between postnatal, labour ward and the low risk birth centre. So yeah, the course has been very beneficial.
Good. And what about feedback? Did you get any feedback from the lecturers when you were doing your PDA?
During the course, it was the very, very first time where the course had been available. It was new within NHS Lothian staff to be able to do this course. It was run with Edinburgh College as well, so it was very new. So there was a few teething problems, but overall it has been definitely worth it. The feedback from lecturers, I would have preferred to have had a wee bit more on how I did on the course, with percentage wise, rather than just being told I passed. That would be one little bit of the feedback, but the lecturers were fine. They were very supportive throughout the course. As I say, returning to studying from a long time away from studying, they helped give you proper guidance on what to expect and what to improve with referencing and things like that.
Good. And what about managers?
My charge midwife was very supportive. She allocated times of me being out with my role so I could focus on the course. I was given a mentor on the ward, and I worked alongside her. So my manager was very pleased that I was working towards progressing within this role, as it was going to benefit the ward, as it can help with the workload of the midwives, because you're allocated to a midwife to work alongside them in the maternity care assistant role.
Good. And service users, that would be the mums, and do you get feedback from the babies?
What I really enjoy is the feedback from the parents, both mums and dads. So it's a big experience, total life-changing experience for these new mums and dads. Babies don't come with instructions, so they look for a lot of questions and answers from the workers. We get asked to go home with them a lot, but the feedback from them is normally positive, especially when they're learning to feed and how to handle newborn babies and things. It's a lot of, it's a very rewarding job.
Good. And what are your career aspirations for the future, Kelly?
My main goal is to do my midwifery. It's always been an ambition, and that is what I'm looking to do. The course has given me the background of going back to studying and how things have changed. I did my exams in 2000, so it's been a long time, and the PDA course has definitely helped to prepare me for the next step.
And perhaps giving you the confidence to believe you can do it.
Yeah, especially working on the ward. I've got 4.5 years experience of working in a postnatal ward now. So yeah, I think that will help.
And what advice would you give other potential students who might be thinking about taking up that PDA?
My advice would best be to take your time, do as much research into different areas as possible. It is definitely worthwhile. Get as much support and learning time management with it if you're working, if you've got a young family, not leaving everything to the last minute, doing things steadily through the course. But I would definitely recommend the course.